So Deborah is from Luxembourg and has so many skills in about where to start. I'm going to just share a little bit. She's a trauma professional, going back, she's a hypnosis instructor, she's a clinical trauma therapy person, certified hypnotherapist in Ericksonian hypnotherapy, resource therapy, and advanced ego state, certified EMDR practitioner in 2013, internal therapists.
And blah, 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 blah.
And yeah. I got this bio.
Let me explain that. Yeah, exactly. Let me explain that. That's, again, I think that really comes into the parts therapy. There's a part of me that just always feels, you know, not always. There's a part of me that has this incompetent part where, you know, I just, and it comes on, and if that part of me is here right now, we're not going to go anywhere. I mean, nothing's going to come out of my mouth. So I keep her to the side, you know, and I know she's there, and I'm telling her, we can do it now. We're doing good. But she does pop out sometimes. And I was thinking, you know, earlier this morning, I thought, oh my God, you're going to have a brain freeze. You're not going to answer any questions. These people are all therapists. They know, they're young. They know so much. Their brains are working, you know, and I'm like still like grabbing for more and more information. I thought, oh, Savat, you know, it's good. You've had enough. That's enough. Yeah.
So yeah, exactly. We're acknowledging the different parts of us, and sometimes we can feel like in a part of competence, and sometimes that can be a state, especially if you're hearing new things. If you've got to learn a part out, it can feel a bit unwieldy, shall I say? And and it can, I don't know, I'm doing running training, we're on day 6, and often people are like more confused by day 6 than they are on the first one. We managed to do that.
So much information sometimes, yeah.
So there's a lot of.
And that's probably, that was something when you invited me and wanted me to talk about EMDR, because I work a lot with EMDR and resource therapy.
Yes.
But inner child work, there's a lot of stuff that kind of comes into it. And I thought, okay, but I really want to be clear for you who are interested in learning resource therapy, to be very clear about, when I work with a client. But it's true, I bring in so many different things that sometimes I'm not sure what it is. It's Deborah's cocktail. It's my clinical inclination of what just feels really right at that time. And any protocol in the world I can throw out the window if it just doesn't feel, and the protocols are great, EMDR, resource therapy, thank God for protocols. However, I don't always go exactly. It just kind of interweaves, and yeah.
Well, thanks, Deborah. And I want to make it very clear, because I think I almost got to the point where you're not just an EMDR practitioner, you're a consultant. And so I think that's important.
Consultant, I didn't get certified. Yeah. So to make that clear, I did the consultancy training. I made a video of somebody, and you're supposed to do a group video. And I thought, oh, forget, I'm tired of all of, Okay. So
but you've seen a lot of people. Sorry, then I apologize. I thought you were, but that's okay. So you've had a lot of experience in these different modalities. And what you're saying is you have your own specific cocktail of Deborah.
I think everybody should have their own cocktail of how, how they're going to incorporate all of the wonderful things that are out there to present the best to their clients. Yeah.
And clients that fit into a box.
Yeah. And not to get stuck with, I think I do a lot of supervision with EMDR practitioners or people who are just learning EMDR. And I think that they get stuck really, really quick with just having to stay with that protocol and get the SUDS. And everybody knows EMDR? I think you mentioned that.
Some people will and some people won't. So you want to, So
okay. If you're gauging kind of how disturbing whatever you're doing to the person is, and I think sometimes I throw that out the window, I can see on their face if they're upset. I'm not going to ask, are you, how disturbing is this? So again, it's like using the protocol, however,
yeah, it's a protocol I'm hearing is informing you, but you just go with what the client's presenting with. If they're disturbed, you're going to see that and go with that. So,
Yeah.
so
Yeah.
I guess this is a wonderful opportunity in a way to think of EMDR and parts therapy, how combining that, and sure, I think that's a work in progress too. Fantastic to have you here today. And this is one of the questions that we use in resource therapy, or our therapeutic question, which from you, I'd like to ask you, Deb, what is it you're ready to tell us today?
Well, I think what I'm ready to tell you is thank you for being here. I mean, thank you for asking me to be here. Thank you for giving up your Sundays. And again, I think taking care of ourselves is the major thing, and certainly for therapists. And then you can take care of your clients. You absolutely have to be taking care of yourself. So I'm very grateful and happy to be here. I mean, I can give up an hour of my time. That's not a problem.
Thank you. Thank you for giving up. Self-care. Yeah, it does, isn't it? If we're not looking after ourselves, how can we be available to our clients too? So, and
that's for sure. Especially, I think, in trauma work. I know as I started working, well, when I became president, oh, here we go, president of EMDR Luxembourg, that just kind of happened because there was no association here in Luxembourg. And I was a new practitioner and absolutely wanted to get to know other people who were doing EMDR in Luxembourg. So I looked around and actually found people, and then I started the association, and then becoming president meant that I was getting, for some reason, all of the most complex traumatic cases that exist to work with. And that was like, whoa. It was pretty mind-blowing. And EMDR by itself, for me, wasn't doing it. I absolutely needed more to be able to work with the complex cases. And Ego State did it for me. So,
yeah. So originally you would have learned Ego State. Yep. So and the first feedback, sort of someone will come from someone. Is it okay if I ask you to mute yourself just in case? It might be two computers nearby. That just feedback. Sorry, you were going to say, Deborah?
I'm not sure. What was somebody asking a question? I couldn't hear.
There's nothing on there, is there?
Just gone in, isn't it?
Okay. So what? Yeah. I'll just ask everyone to mute for now, but I want to be able to accept Deb come in because there are some wonderful questions. In fact,
I bet. Yeah. Definitely.
And we can talk about that.
Right. So what I was saying, as far as working with complex trauma, for me, I mean, other people have, I needed more than EMDR. It just the basic protocol and all the books on EMDR, and there's 50,000 books to adapt. I think the basic protocol does enough. That's fine. I don't really need to use anything else. Just the basic, but interweaving to be able to work with highly traumatized clients. I trained with Dick Schwartz in family systems, internal family systems. And did level 1, 2, 3, whatever, through the whole thing. I actually worked with Dick in Switzerland. He came to Switzerland and it's really funny. I mean, after all the time I spent with it, still really didn't get all these firefighters and protectors. And I don't know if anybody is familiar with Dick Schwartz's method, but in any case, so it still didn't click. And that's what I ended up searching on internet and came across a couple of books. I think Ego State Therapy was one of the first that Gordon wrote, and just ordered it, read it, and said, okay, I'm going to look into this guy, and then looked him up and then saw these resource therapy. And I said, what is that? And actually signed up and took his course. And that was amazing. It just makes me think seriously of my mentor would be Carl Rogers, client-centered, person-centered therapy. That was my favorite. And it just resembled that to me. Just very, very person-centered, human, no psychobabble, which I just, although there's a lot of vocabulary with the Veded and the retro, and there's, you know, every method has their vocabulary that makes me go crazy. But once I get through that, it's pretty limited, and the method, I mean, the approach is very easy.
Yeah, right. So I can hear that. Well, a wealth of experience in different parts modalities there, internal family, sex sports, and you came across ego state, which transformed into resource therapy or advanced ego state. And you did the training with Gordon. Gordon, listen to me. I agree with you. It's kind of like Freud's still alive, but in a nicer, such a humble, gentle man.
Humble, totally generous. Will give you everything he knows, everything he has. It's like, oh, I love that. And not all of them out there, and I've met a lot of them over, you know, since the 70s. Believe me, I know a lot of them. Not so generous. You know, come, you know, buy my book, or you can't talk to them. Yeah, he's very available.
He's very available. He's a president of Resource Therapy International at the moment. He's sort of taking a bit of a back seat at the moment. We're now clinical trainers training his methodology to. It's so amazing, and everything is, we can give out the books and etc. We send it all, it's all online, because I can see someone's there. Sorry, yeah. So and there's training. So look up, I run resourcetherapy.com.au. There's Resource Therapy International. There will be training around the world, in Europe, because Gordon went over before COVID and trained around 40 psychiatrists up to the 10-day program.
Yeah, I heard he was in Germany.
Yeah. And now, so there's actual trainings in German, there's Indonesian, and an Indonesian gentleman's just written a book.
I saw that. Wonderful. Yeah. Yeah, and in Indonesian or whatever.
On performance management, I'm like, I want to, you know, like sports performance and peak performance. I want to see that in English.
What is cool about resource therapy is that he, you know, himself was an ego state therapist, and like anybody, they just take it to the next step. So you get that basic ego state. He explains, you know, and he just went on to build onto that and took off from, I guess, Watkins, and who he had actually trained with or had been with for some time, and just took it to another step, another level, which seems much more logical to me in any case. Yeah, it
certainly is, isn't it? Gosh, I'm just going to put some links up there.
You have a hard job there. You know, you're focusing on getting people in, and you need a secretary. What?
Look, Chris, he's in the lounge, and he's not very good with the cat. That's my husband. He's been training all day. So I do. I just put up the link to Resource Therapy International, so that's the website in the chat. And I actually will put up too. Here's, because I know people are interested. There's something wonderful about being able to see all the stuff. Oops, I just did the wrong thing there. It's talk about multitasking, but yeah. And I've just lost where I want it. Oh, there we go. So actually, Gordon, even in his generosity, is putting up heaps on the internet as well. And that's why I'm doing this sort of thing. He's very inspiring. Let's see. You can actually see there's 15 treatment actions of resource therapy. So it's got a clear sort of protocol in that sort of way. And that fits into each of the diagnoses. And that's how I come to also, probably other people with EMDR training, you realize once you're doing EMDR, you need parts therapy behind you to actually be able to help process. So I've also, thanks Susan, put that and those are the actual demonstrations of all the actions. You'll see the wonderful Gordon, and he looks a little bit older now.
Don't we all?
Oh, he's going to be 70. So
me too. I'm on my way. Yep.
Yeah.
Almost.
So wonderful. So
that's my chronological age. My mental age is much younger. I mean,
21.
Wow. Easy.
Yeah, it's only a number, isn't it? And we've got people from all over the world coming in. It's wonderful. I'm in Sydney. I'm just looking through Bernadette, and we've got some questions coming in. Linda's saying she wants an intro and an overview to part therapy to satisfy curiosity. Have a look at those websites as well. There's a lot of information on there. Those books as well, you can get on Amazon, Gordon Emerson. I'm in the process of writing a skills training manual too as well, with some beautiful cheat sheets and things like
Good for you. That's great. Yeah.
yeah, one day. Yeah. And you've written it quite a lot extensively too, haven't you, Deb?
I have not.
Oh, you've written it well.
No. I work in, person to person. I have a private practice. I work a lot with the judicial system, where I work a lot with kids or very dysfunctional families. So again, my language always has to, and I work in French usually, but when I'm speaking with clients, and again, for myself too, I don't like the psychobabble stuff. People don't, what's your negative cognition, or like, hello, what? I mean, who understands that? So just kind of adapting the language to your clients is so important too, even in resource therapy.
Oh, absolutely.
Even to your students. I think to
try and
explain.
simplify. Yeah. So
yeah, simplify, definitely. I mean, everybody loves to have their own terms, but
yeah, because Gordon has a couple of unique ones in resource therapy called VADED, and VADED state is a part of resource part, and our resources are resource parts or states. We use those terms interchangeably to mean a part of the personality. So, and there can be only one part in the driver's seat at once. Right now, my kind of presenter part, running this meeting.
And I'm trying to be my professional part should be out, although my little incompetent, part, and my part that says you're going to have a brain freeze is in the back. She's just kind of, and if she's taking over, forget it. It's just going to be, I'm not going to be able to come out with anything. But yeah, she's not. But she does come on still. It's amazing. She doesn't take over, but I'm aware of her. She's a part of a little child part. Yeah.
Yeah, that's a good thing, isn't it? All our parts are there for a great purpose, but sometimes they're out at the wrong times.
Exactly. And I just wouldn't want her to be taking over. So, and I think that's really important for therapists. When you have your client coming in, you usually have the part that is looking for help, but you might not have the part that really, that state that's really having problems, and you want to, and we do that with EMDR too. We have them float back, or in resource therapy, we have that, that initial sensitizing event that you really want to get back to that moment, that all came on. But in order to do that, you're going to have to bring that state. You need to be talking to that state. And I think that's really important. And they kind of miss that for me in any case in EMDR. So, you can do the phase 1, phase 2, and then I kind of interweave, resource therapy into that.
You've actually got the right part out in the interweave, I imagine. Yeah. It's really holding the pain, the distress, the unhealthy
Exactly.
And float back.
Exactly. And then again, we have body sensations in the EMDR protocol too. I love the way that he presents the body, like where in your body are you feeling that, that fearful or that worthlessness or whatever, and your throat, for example, or your stomach, and just being able to kind of, identify that area, describe it, etc. I love that. It's one of the steps in resource therapy that really helps people themselves kind of get more of a clarity on what, and people they come out of that state a lot for me, and want to come back into like, what is that all about? And I'm just going, let's go with that and see what happens. And most people are really, kids are great.
Tell us about your work with children, actually.
Yeah. I was just thinking recently, I had a little girl that I'm not taking on new clients, but famous last words. I got a call, and this little girl there was an attempted kidnapping. Some guy drove up in a black truck and told her to get in, and she froze on the sidewalk. She's 8. 8 years old, just like totally froze, and then took off running. So she was fine, but of course she's not so fine. So I thought, oh well, when I heard what it was, I thought, yeah, this is going to be quick. No, but I thought it would be. So I used the air TEP, the air TEP in EMDR. Again, I don't know if anybody who's familiar with that, but it's, you know, where she'll just talk about what she went through. In fact, it wasn't just that trauma. I thought because she was young, this is going to be a simple trauma. We're going to get through this really quick. And in fact, no, this kid has had a horrific life. So yeah, it gets complicated.
Yeah, so we can never assume, and that's the beautiful thing. I think with parts work, you'll go and work with the parts you need to. And I always think resource therapy is a beautiful, we are concerned not with what's happened to the person, or so we are concerned with what's happened to the person, not what's wrong with the person. Always remembering, actually it's one we didn't meet in Milan, but Carol Forgart talking about the ACE scores. So we need to keep those in mind, our adverse childhood experiences.
For sure.
I don't ask my clients that because I can just generally do a genogram and I've got that already, you know, the neglect and how that can show up. Yeah, so that's so interesting, as a little 8-year-old carrying already loads of ACEs there up his sleeve. You know?
Yeah, definitely. But she was able to find a resource, which was really interesting, or a nurturing figure, very quickly, and be able to like have these. She has a lot of superheroes and mangas and stuff that she watches. So I printed these out on my computer, all the pictures of these different superheroes, kind of mapped it out, and she could bring those in to kind of surround her, to protect her, because I actually worked with her on shrinking this guy down and being able to, that's a great step in Gordon's resource therapy, is by taking this guy, the introject, taking him and shrinking him down to a little tiny thing that she could actually say. And I talked to him too. And again, that's resource therapy, that, you know, that is not okay. She is a little girl. Every little girl has the right to be walking down the street. You have, you know, and letting him have it. She could let him have it in her own way, which was really empowering for her to be able to. That took a while to be able to get her to be able to, or propose that, and that she was good with that. But it's an amazing step to be able to empower the child. And she was very powerful. I think Grandpa was probably there for her, that probably protected her and said, "Run, sweetheart, run." And she actually heard him say that again in the session with me. And it was just like, wow, there's just so many absolutely fantastic steps in resource therapy that you can, you know, pull out and interweave into, you know, working with your clients.
There are. And can I just explain a little bit too, perhaps, for those, and I'll come back with a question because there's a few good questions here, but the empowerment protocol is resource therapy actions 3, 4, 5, 6, 7, where you bridge to that initial sensitizing event. In this case, the 8-year-old's been kidnapped. Sometimes it's not known. So it'll be and trauma happens in our childhoods. It's parts holding stuck emotions, fear, rejection, that when it's out on deck in the present is coming up with that amount of affect right in front of you. Whereas, you know, this in your therapy rooms, there's no need to be scared of, you know, whoever you're sitting across from, because we're a safe place. And then we do with the empowerment is expression, removal, relief, and introject speak. That's where the part that never got a voice gets a voice, isn't it? And says what it needs to say.
Definitely. You know, and it was really interesting because there was the idea, she was really upset that she felt paralyzed, which is a totally normal reaction. You know, you fight, you flight, or you freeze. And so she froze, and then she took off running. So there was something in her system, that survival system is like, honey, go. And she did, you know, and being able to empower her to recognize that and get her connected with that part also, because she's walking around with a ball in her stomach now and scared to death of any car that drives by. which is obviously normal. At the same time, you want to, work through that and get her connected with that very powerful little girl who could take off and run.
Exactly, and that stops like generalized anxiety disorder, PTSD. Well, she sounds like she already had PTSD.
Yes,
Already
exactly.
complex PTSD from her childhood and so early. So let's, someone actually did, just before we get into the questions, talked about the air tap. Ruth, I didn't know what that was. Can you just give us a brief?
Air tap, R-TEP. Air tap is, I think it's Alan Shapiro, not Francine. He's from Israel. He comes over to Europe all the time. America, I've heard too. And he teaches a protocol for like catastrophes, just something that happened like right now, rape, and refugees coming in, just very recent trauma.
I'll try and find a link and put that in eventually to send out around to everyone. Okay, so yeah. How do you spell it again? Could you say that a bit?
R with a hyphen, T-E-P.
R-TEP.
Exactly.
Romeo. Yeah. Thank you, Alexia. Thank you. You know it. If you can put a link around that, that'd be great too. Thanks. Beautiful. We get the brains trust here. So many beautiful brains.
Yes, that's fantastic because it's a great protocol. I mean, it's, you don't have to go to the training. Seriously, just get the protocol. And for those who've been already trained, no, seriously, you really don't. It's very clear cut. But it's like doing a Google search. You just have the child kind of like, as she's watching on the screen, just, tell you out loud from the beginning, maybe a couple hours before the incident, all the way through to a little bit, up till now, till today, everything that happened. And so she's able just to talk and explain what happened. And then I have her go back through it again. I'm usually using the bilateral stimulation throughout that, again, in EMDR. He's EMDR pure, Alan Shapiro. But it's excellent. And then she goes through this thing in her mind. She reviews the whole episode again. And then she stops at moments that she just feels really emotional. So you're getting more targets, or you're actually getting the baited states, that is present.
Yes. Oh, wow. That sounds really great. I'm just also...
They haven't been to Australia yet. Okay.
Who's that?
Because it's a whole team, Alan Shapiro. He does travel around. You guys are so far away, and now, boy, but he probably does it online too. I have no idea.
Maybe.
Get the protocol. You don't need anything else.
And maybe that could be in the group too. So I'm just going to the chat now, and what I'd like to do is the person that's raised the question is that if I use your name and if you just put up your hand and you'd like to be able to ask your question, that'd be really wonderful, just to hear some beautiful other voices here. So I think Ruth, you asked the first question, Ruth.
Yeah. So I'm interested in the kind of barriers that our clients will have in us doing the parts work when all of their, say, defences come up and they actually run away from it. How do we overcome that?
Yeah, I think that it's important to give a good definition of really what, parts are, because a lot of people, I think the biggest obstacle is, oh my God, you think I'm schizophrenic? That I hear all the time. Oh my God, I'm dissociative. No, definitely not. We all have parts of our personality. And then I explain, the little girl part, the professional part, maybe a child, a young part that maybe comes out, maybe when you're speaking in front of a group of people. So I explain personality, and I do a mapping with them, and they enjoy that. So it's not scary. If you map out just their different personality parts, and they'll say, well, I'm a wife and I'm a mother. And so you can just vaguely go through it, and then you get into more of the emotional states. And yeah. Does that answer, Ruth, anything that you asked? That's one big obstacle for me, is people get scared that they're fragmented and psychotic, if I'm talking about like inner voice, or what are you saying to yourself? It's like, oh my God, I am, what do you mean? And again, these aren't people who have read anything about therapy, so it's just taking it really simple and slow, that we all have a little voice that says, no, don't do that, or oh, you're no good, or you're not good at that, or whatever. That can be very, very saddening. I mean, yeah, stressful.
Is that, yeah.
Thank you.
Okay.
So good, isn't it? And I love the way you used also as well yourself as the therapist and your different parts. You're really normalizing that we all have them. Yeah.
Oh, yeah, definitely. And I think normalizing is exactly, Felipa, that's the word, it's just scary already to go and see a therapist, and I hope everybody's been on the other side. I hope you've all been in supervision, or I hope you've all been in therapy, so that you do have a sense of that's scary, and you have a lot of power, and I think that is that power. So be very careful. It's important what you're saying, and what you're doing is always to be helpful and to that person. And maybe, I think maybe you asked me what I had to say. And again, I think being able to be there with the person, because as therapists, after a while, you kind of know what's going on with them. But if you know and they don't, how can that be helpful? You know how you can be like a few steps or way more ahead of the person. And with age, I think, Deborah, get back there, be with that person. You need to be with them. They're not there, and helping them and be patient. I think that's where I find Carl Rogers is empathic, being authentic in the relationship, and just being really accepting of that person. He was my hero. Yeah. In the 70s.
Yeah. So
do you guys know Carl Rogers, or has he like totally completely disappeared from from bookshelves? I don't know.
One of my students is doing a master's in counseling, so they're talking Rogerian, and I'm like, oh, I love that. That should be like the foundation of, I think, is that just beautiful.
All therapy definitely should be the foundation. Oh yeah. And I think we always forget with all of our little tools and our approaches, and we just want to come in all the time with all of these things. And I think just hold back. And sometimes it's just holding that space. I'm thinking of bereavement. Do we say that in English? Grieving?
Yeah.
When somebody, and you're working with a person, and I've had people in supervision say, yeah, I'm going to do the protocol for grieving in EMDR. I'm thinking, oh my God, somebody's coming in. You're not going to do anything. You're just going to hold that space. You're just going to be, you might cry with them. It's like, oh my God, cry with them? Yeah, I could cry with them when you're hearing the pain of a mother losing their child, or a father, or whoever they've lost. It's very powerful to be with that person and not be bringing in all of these tools. It's like, that's, yeah.
So
that for me was a nugget of advice that I received from somebody years ago. And I thought, oh God, you're right. You just get kind of technique crazy.
Especially when you learn something, you want to try out your techniques.
Yeah, of course you do. And it's all with love, I hope, and sometimes you don't really have to have all of that. You just like holding the space. And we have the luxury in Luxembourg that children are paid for by the government to see me. So I can take as many sessions as I want, which is absolutely heaven. It's not like you have 10 sessions, hear them. And I get people who's like, oh, here we go, okay, tell me your story. Up, now we're going to go. That doesn't always work. But I get that some people don't have this luxury.
Yeah, I'm very honouring. Here in Australia, there's often a lot of restrictions for people around mental health care plans, and costs, and people trying to offer therapy and have a private practice and make a living as well. The tension around that.
Definitely.
we do have victim services, which is really good, and you get 22 hours. And someone, they're fantastic because you don't feel the pressure. So yeah, otherwise, if you've got to try and jam someone in, I know that is a pressure. Anyone else from around the world? How many sessions would you have in Greece or anywhere other? Love to hear. Alexia, is there a limit to your sections, or Joanne? Anyone care to just share on that? Yeah, just unmute yourself.
Unmute yourself. Yeah, exactly. I can hear nothing.
Appreciate that.
I can be here at for 45 minutes more.
And is there a number of sessions you can have for the 45 minutes, like 10 or 20, or is there?
No, I think she could be here. No?
Oh, sorry.
I can't hear you because I think you're stuck.
Oh,
Can you please repeat?
yes.
Alex, do you have a question you'd like to ask?
I was just asking about from Greece, how many client sessions that happen in Greece. I'll just put my earplugs in too. That can help. Yeah.
Would it be helpful if I put a speaker on? I have a...
I think you're right. We're dealing with the Wi-Fi and connectivity of the world, and sometimes I was working with people in Canberra where it kind of blacked out, torrential rain apparently. So let's go to some of the other questions here, and we've got beautiful Alison has a question. Alison, can I get you, if it's okay, you can, you don't have to come on video, but if you could just unmute yourself, I can see you. Alison Glass, just, is that all right? Just out, or yeah, because I'm not sure how many. Are you there, Alison? Sometimes people might have ducked away.
Can you hear me?
Yes.
Better?
Yeah.
I can hear you perfectly. So can you hear me better like this? Like
yeah,
this?
that's good.
This is better? Okay. So I won't put this on.
Yeah, if you don't need to have things on you. So it's kind of good.
I know I have this gun on my head, so okay.
And so working with, so people are kind of curious about where and how to interweave parts work with EMDR, because that is a curiosity. And I mean, usually you start off, and I'm still trying to figure this out too, really,
Okay.
how to do that. Any suggestions, thoughts, ideas on that, advice, Deborah? Yep.
How to interweave.
Where
Just
do you,
natural. I wrote down some notes. I was thinking about a little boy that was
case studies are always great.
Came in, I guess 13 years old, came in with suicide thoughts and just feeling really bad about himself, and his parents were really, really concerned, and he was just saying a lot of weird stuff. And so what I did was to identify the pathology to start with in resource therapy, what I identified, he was being mobbed at school. There was a lot of mobbing and feeling really worthless and just really bad about himself. And so while I identified that, in resource therapy, I could give it kind of a diagnosis and what steps I was going to use. However, I would weave in EMDR into that, where I would be using the bilateral stimulation at several points. I'm just looking here at what point. As he's talking about one of the bringing out that bully, that experience that he had recently, we were able to go back to, and again, you're floating back in EMDR, but you're doing the same thing in resource therapy. You go back to that original moment that he felt worthless and just bad. And actually, again, it had been going on for like 3-4 years in this one particular school here in Luxembourg, private school, where the kids had being harassed and just closing down little by little by little. So it finally took like 3 years. So going back to that initial sensitizing event, or the float back, the touchstone event, as we call it, you are interweaving one against the other, or with the other. They just kind of, it fits. absolutely beautifully.
Can I just sort of, so I'm getting it, just so I'm hearing you started with like, okay, presenting, he's been bullied,
Yep.
mobbing, it probably doesn't translate, but bullied at school. And you're realizing, and of course we know what sets us up for bullying is probably less than ideal stuff happening earlier. That kind of, because, you know, those, yeah. So how old was your little person? How old was he?
He was 13, something
13.
like that.
Yeah.
But we're able to go back to, which is really interesting. He had been bullied at school though for years. But actually, as I got to know him, he had a little sister. And that was probably the first moment that he felt kind of rejected and worthless, is because the little sister came on board and he was dethroned and was no longer the king of the house, because he definitely was the king of the house and the center of attention. So at that point, you know, and he had a hard time with that too, because he loves his sister. He didn't, the idea that he could have been maybe feeling jealous or rejected by his parents was, it took a lot of time to be able to, he was convinced that everything was happening and because of the bullying, and that was, I mean, that's for sure, it didn't help. Parents didn't have as much time to listen to him anymore either, because there's this baby in the house. So yeah. He worked, so the bridging, I think identifying the body sensations with him, being able to express, and this again, for him to be able to go back as this 14-year-old today, to go back there and talk to those kids, saying that was, and just shrinking them down again, as I mentioned earlier, shrinking them down and saying that, you know, you made me feel really bad and that's not okay to do. And it was just really empowering. And I was using I have these buzzers. Kids love the buzzers, in EMDR. So he was, at that point, I would intervene with the buzzers as he's empowering and feeling really, you know, able to get through it. Yeah.
And I'm just curious, because with the buzzies too, so I'm just going to sort of paraphrase a little bit. So yeah, you've started with the present bullying, but there's earlier stuff, and you went and to the worthlessness, which probably is exactly like that. Another siblings arrived, and when you're a little person, you don't have the capacity to.
And me, yeah.
Yes.
Sure.
And that's where those feelings of worthlessness, it sets up kind of him to be sort of, you know, marked out of the herd by bullies. They're very good at picking to the sensitive folk. And then you use the buzzies. So the thing, I've got the board actually, and you can plug that in. And has the person got, the little boy, did he have his eyes closed? And then you're just kind of doing that as he's talking?
As he's talking, exactly. Yeah. And it's extremely powerful. And today, like I do online with him because actually he's on vacation. So I've been working with him for about 7 months now. And now he actually talks about that part of him, that resource state that kind of came on while he was on vacation and wanted to talk about, you know, it just kind of came out, and he said, but I said, you know what? I can handle this. And so some kid said something to him and he could handle it. And I thought, oh my God, that's where resource therapy is so powerful. It's like that state will change, where it hadn't changed since he's been a little boy. He just felt rejected and worthless, and just kept getting carried on. And once a kid said something to him at school, it was like, yeah, they're right, I am worthless. And he just kept closing down for years, you know? So that's pretty, it gets really imprinted into his little brain, and so repetitive that it was hard for him to get out of it. Yeah. But
lots of experiences.
That's ego state, and that's resource therapy, 150%.
I'm just going to say this too. I think this is curious too, because you could have gone like, that's a schema, right? I'm worthless, and etc. You don't have to tackle that belief system with resource therapy. It unfolds and re-emerges and recalibrates, doesn't it, to I am worthy. The positive, once it's processed. the unhealthy emotions. It frees and clears the person up to be capable. So many.
Well, he got a good understanding of where he learned that he was worthless, even though he wasn't. Or those kids said that, and he believed it. And then now, when he looks at a little 7-year-old or 6-year-old, if that's happening to them, as an EMDR interweave or even in resource therapy, when you see that happening and you want to like bring on kind of a resource, what would you say to that little 8-year-old? Is he worthless? Is he a horrible person? And no, I'd go over there and I'd help him. I'd tell that kid to leave him alone and blah blah blah. So it's very empowering, and
very empowering. And that's another part of the personality that steps up to help, which is a bit different to classical EMDR, which would be like a sort of the idea of an interject. So that's a bit different. I'm just can I just say a little bit on that? So
yeah, please.
Resources are internal things, but interjects are memory fragments, like the imaginal event that you're dealing with, a mother or the bullies, for instance, or a group.
Bullies are telling me I'm worthless, and I believe it, and I continue believing that for the rest of my life. It's like,
fuck.
Yeah.
Yeah. And Deb, we had a question too around using this on Zoom, and because I imagine you didn't have the buzzies in that one.
In which one?
If you're online, or unless you use online stuff.
There are apps. You absolutely can.
Yeah. There are.
Is
there one you prefer? Because Joanne's just asking.
Oh, yeah, Joanne, there are apps out there where you actually can have the headset. You need to be using, I believe you should have definitely in online therapy have a headset on, so it becomes much more intimate. I absolutely refused for years to do any kind of online therapy. I thought, oh no, I need to see the person. And then you get confronted with this crazy world we're living in now. And so I started only with clients I knew. I wouldn't take on new clients. And amazing, in the privacy of their homes, or usually their bedrooms, they're sitting on the bed, but I got to know them in a whole different way, clients, and that was pretty powerful. Yeah. So, but there are apps for the bilateral stimulation.
Yeah, I think I've got a friend that's got a beer.
But you can have
butterfly hug.
You can be, if I'm doing this, the butterfly hug, and at the same time, they can be doing that. So you're seeing that they're actually getting the bilateral stimulation. Yeah.
Yeah. I often use the butterfly hug.
Yeah,
no, I often use the butterfly hug in combination with resource therapy, because people, you're working with the child state, we often have their eyes closed because they're really focused in. So they're not going to be doing eye movements. So this one, and this one I love because the vagus nerves run down here. So that is the butterfly hug. It's really amazing. And I've got like one guy, we just did tapping. He kind of went into a state of, I think, very young state, pre-verbal. So I just got him to keep tapping on his legs, because his teeth, is quite intense, and that was able to process it. The other one I've got, and I've got another guy, he's just so emotionally labile, it's parts work, and I get him to tap his feet because he's quite disabled physically, and he can just tap his feet, and that's amazing. He said, I just feel better. Going from like a 10 to a 1, not that I'd label it, but his tears and to like, oh, I get it now. It's amazing, isn't it? So I think they're really powerful in rewiring our limbic system, our brains.
Exactly. If you're thinking everything about you is pathological, I think that would be really sad. These states, these pathological parts of our personality come on at different times, throughout our lives for a reason. Somebody said something. I'm not blaming moms and dads, although moms and dads are often responsible. Not always, but often.
Yes.
Yeah, and you want to be able to get to that resource, and once the person has that distance, also knowing. I think when somebody says, for example, I'm depressed or I'm anxious, and I said, well, it sounds like a part of you is depressed and anxious. It's just like, oh, okay, well, you know, how do you feel about that? And that part of you that's feeling anxious or whatever, it's really, really interesting to be able to be separate from that. Otherwise, I am is like, it just stops me at that. I am depressed. There's a part, there's a depressed part that exists. Yeah, and the personality and when it came on and getting an age for that. And
yeah, and that's usually in adulthood too, quite often the disappointed part.
Definitely.
So,
Yeah.
and I guess too, just to clarify, when we're talking Interweave, we're not using the technical terms so much of EMDR. It's probably a bit,
No,
being a bit
I'm
naughty
not.
there, but just sort of as Ruth has brought it up, and it's integrating. It's kind of just melding it a bit together in a hopefully a more even powerful methodology. And I've got a question from Liam. Liam, do you remember your question? I've got it here. Can you see in the chat? Yep.
Yeah. Yeah, I was just wondering, do you explicitly bring out the vaded state before engaging in bilateral stimulation? Or do you try and ensure that they're sort of more in a healthy state, but still activating the memory network at the same time to sort of ensure that they're regulated?
Depends, seriously. I know EMDR would say resources. And I think definitely resources are really important. It really depends. I depends on the clinical case, my clinical feeling about what's going on. If I feel like the person isn't really that stable, I might continue going on with the bilateral stimulation to hope that they're going to be getting stabilized. But like with the little girl, we did the nurturing figures, people that she really are superheroes. And I did this before, actually, I was working with her because I once I heard her story, I thought this is going to be complicated. It's simple. It's going to be very complex. So yeah, and she would have those that she could go to help her.
That's a good question. Can I just sort of add on the resource therapy take? We'd probably get the part out with the emotion and then process with the BLS. But I might use, with their eyes closed, I might use the tapping more than that, or the buzzies in the ears rather than eye movement. Because
but I think what I understood he was asking, though, if the person's getting like really, really activated, is that what you're saying? How do you help calm them down in resource therapy? Is that, Liam, is that what you're asking? Or how
No, it's more so around, would you try and ensure that the particular state which was vaded in the past, or where like the ISE would have happened, bringing them out before you're doing bilateral stimulation, and would that make it more effective because you're connecting and doing the stimulation with that particular resource state rather than like a reporting state?
Yeah, I would use a bilateral stimulation without a doubt.
Yeah.
While I'm working with an emotional state, even though they're really highly activated. Yeah.
So would you like vivify specific before then engaging in the EMDR process?
What do you do vivify specific? I'm looking here.
So that's getting the part out in a sort of way. You kind of already are, Liam, in the protocols when you're asking, think of that image. You're getting the part out in any way, shape, or form.
With this bullying kid, I think as he's describing where he is and just feeling suicidal or whatever, I would definitely be using the bilateral stimulation. Yeah. During the vivify specific.
So I might even just, Liam, some people won't know what that means. I'll just give a little explainer. Yes. And so vivify specific is resource therapy action 2. So the first thing we do in resource therapy is we diagnose the pathology, i.e. what's happened to this person. Are they dealing with unhealthy emotions or behaviors, etc. And then we vivify, get out the part we want to work with. So we're always kind of vivifying to work with that part.
Part's out, it can be really upset. Yeah, and I think being upset would be definitely a moment that you would absolutely want to be using the bilateral stimulation.
Yeah, because that's actually desensitizing and reprocessing.
Exactly.
And so the memory networks, we're bridging to access those memory networks, which is a bit different to EMDR protocol. So we're using an adaptive thing, and it's helps deal with those attachment ruptures and repairs in the empowerment process from that little boy there's an attachment missing, not just through the circumstance. I think of the little boy with the bullying I'm thinking of, whereas
Right.
little sister, he's now gone from secure attachment to I'm nothing anymore.
Yeah.
Have that happen as part of the other steps of the empowerment. We've bridged to that wherever that moment is. The imagery associated with it, which is more along the lines of Laurel Parnell's work in attachment-focused EMDR, or I really like my stuff. So it's more advanced. I think it's more informed by those sort of meanings. Resource therapy is like, oh, there's something that's showing up in my rooms, that part that's out on deck that's been vivified. And by describing and asking you to tell me one time when this happened, you'll bring out that part or that event, and the kid, specifically. So that's what vivify means. And then if it's holding on to unhealthy fear or feelings of rejection, worthlessness, unlovability, I'm not good enough, we'll always bridge back to where that root cause lies. And it's not in the present, it'll be from our past.
Definitely.
Good question. Thank you, Liam. Anyone else has some more questions? I don't know if Alison, you're here, but I'll ask Alison's question on behalf because it's way up there. So she might just be. So just to talk about eating disorder parts, specifically anorexia. I'm having trouble connecting to an eating disorder part who refuses to allow my client to experiencing any emotions, especially sadness. Alison's saying she'd love to have some tips on this client. This client has a lot of complex grief. Her mum is the same, has anorexia and a fear of sadness. And yeah, she's really relating to you, Deborah. So that's Alison, who works with a complex PTSD person there with eating disorder, a lot of complex grief, and then there's intergenerational trauma, because this is a behavior and environment, and there's a genetic component as well that's kind of being passed down.
Is this an EMDR therapist or a resource therapist?
More an EMDR therapist, but she does parts work. So she's just wanting to talk about connecting to the eating disordered part, who's blocking. It's a protector part.
Again, though, I'm sure you probably have done it, though. You really need to get back to where that all came from, when that came on, and being able to connect with, because the eating disorder today, it's extremely dangerous and extremely complex, and they're not actually my favorite clients because I don't have a lot of really great success. But I can tell you what I do, what I have used with people that it was successful. She presented with eating disorder, actually was sexually abused, horrific abuse as a child. So we kind of bridged back to that, worked on that, having her go in. She hated herself. She hated that little girl who was being abused. She's 4 years old. She felt she was dirty and just just horrible. So and that's something. So she's carrying a lot of stuff. And working on that, it took a year and a half, which is actually pretty cool.
Pretty good.
Yeah.
It's pretty fast, actually.
Yeah, I see her now like twice a year, something like that, because she's pretty stable and she might come in. But I didn't stay specifically on the eating disorder. It was kind of, I wanted to get back to that, just that initial event of what was going on, because what was behind the disorder, the behavior, was something totally different.
That in resource therapy terms, I'll just give you a nutshell. Retro is a part that will perform a behavior as a coping mechanism to avoid emotion. This is the part that will block off the emotional part starting to come out on deck. And as soon as that comes out, I'll perform a behavior that blocks that off. So, and I think that's exactly what Alison's saying, is there's another part that, because it's so afraid of the emotions, and often I find intellectual parts, like I did a demonstration today online, and this intellectual protector part said, oh no, I've already been there. I've done all this work. It was a therapist and training, and they've done a lot of work. And that's not the part I need to work with.
Right. This person too had been in therapy for, I mean, forever. She has read a brilliant woman, so extremely intellectual, difficult to get down into the feelings, extremely intellectual, knew everything. I thought she could have been giving me therapy. I mean, she was like really on ball. So I had to keep bringing her to that emotional state, that emotional child who she was really having a hard time, and trying to find a resource in her, a part of her that could have some compassion for that little girl. And that took forever, that she actually could find compassion. It gives me goosebumps even now when I talk about it, because when she could say, oh my God, that poor little thing, and go in there and be with her and talk to this person that was abusing her, this trusting person, it just made the whole difference.
Yeah.
Yeah, it really did.
Oh, sounds amazing work. And have you got any pointers? I think it's probably dealing with sort of like a phobia of feelings, you know, because when those people have such strong intellectual parts, which I would say protected defense mechanisms. I mean, in resource therapy, do like resistance alliancing and engagement method. Have you got any tips for if people are sort of so afraid of their emotions?
It makes sense that she would, I mean, she definitely dissociated.
I would, yeah.
You know? And that totally makes sense. She was diagnosed with a dissociative disorder, which was obviously stupid, because it really didn't help her any, giving her the diagnosis. It was obvious that she needed to dissociate from what was going on. She was 4, you know, I mean, you don't, how brilliant our brains are to be able to do that, just to, you know, not remember it. And when she actually had her own child, and her child turned 4, is when that all popped up.
Gosh,
it's amazing.
It is amazing.
Yeah.
And
but
sorry.
Yeah, I'm trying to understand what you're asking, like how working with the emotional part, working with nurturing.
There's a part that sort of blocks that off, you know, it says, oh, I don't want to go there. That's, because I can see people nodding their heads going, oh, this is very common, because they just want, you know, that's, there's an intellectual part.
Well, that's with EMDR, which I get with a lot of the young therapists. You don't want to be, or even with myself, sometimes I thought, Jesus Christ, am I re-traumatizing this person, which you definitely don't want to be doing, because they're going back into something that is extremely painful. You have to be really equipped. People are always afraid of people dissociating in their office or having a break or whatever. I mean, it's important to be equipped for that. And somebody was asking Liam, I think, about stabilizing, and stabilizing. That's important, to be able to stabilize the person. But I think there are people that you're not going to be able to stabilize. They're just not going to. So go with them and bring in and use and interweave all of this knowledge that you have, that you're acquiring, to be able to help them heal. There's no cookbook method, you know.
That's true. I was going to say, oh yeah, we'd all be, if we had the magic wand, we'd be out of work. But no, I put up on YouTube as well, there's a 2-hour talk on working with borderline presentations, PTSD, and Mel does quite a lot of, it's different to working straight, easy resource therapy. You need to actually find different parts to be able to find resource, find those more helpful parts before you do any work, and protector parts. So yeah, there's those parts are, like you're saying, I think when we reframe it as a survival, thank goodness you've had this part that's been so strong and powerful that can intellectually get you as far as you can, and you've got these 5 degrees or whatever. That's
these will be your patients, that when you ask them, well, if you have a friend that came over, or a little 4-year-old that came over and said, you know, this was happening to her, how would you react to that? Would you think she was a dirty, filthy, worthless child? And no, they don't. You know, they oh my God, no, oh my God, and that's like poof. But you're saying that to yourself. And we just kind of sit there, go, think about that, or go with that in EMDR.
Yes, that's true. Yeah. Fantastic. And I'm just seeing, Alexa, I like your what you're saying about the tree with different limbs, branches, and leaves of the parts. That's a good kind of analogy. Roots and yeah, parts of us. Yeah. And just going down. And there's some great, have a look. Thank you for all the helpful people that are putting stuff in the chat there. Mark Grant stuff I really like on pain. He's very practical as well. Yep. Australian too, yeah. And Brian Cumming, you can find bilateral stimulation. Thank you. And if we're not, thank you, Narelle. Oh, and well, Simon, you're saying the loving eyes. That's the loving eyes is yeah, a beautiful thing. That's, but I think that is. Do you want to say something about that, Simon? If you're there.
Yeah, so it's something that I've only used just recently, actually. So it just sort of I thought of it with Liam's question. So I've got a client who's got an extremely distressed, traumatized background. Mm-hmm. So she's like, you know, she answers yes on all of the ACEs, but except the last one because the perpetrator didn't actually go to jail. But she has a, like Deborah was talking about it, I think was so she really disconnects with the hurt child part in her, and she just can't. Yeah, I got it from Jim Knight's book. Yeah, and yeah, so I use that, and it was actually her reaction to it. We're still going through it. I'm going to use it probably several times with her. It's sort of like slowly breaking it down. But
are you're looking into her eyes?
No. So this is, so what you do is the sort of apparently normal person, so that sort of rational adult part, you actually, I was looking for something, because when she got into that hurt part, she started to get very, very distressed. She started to, she started to process. She then kind of like take steps backwards as that sort of dissociated childhood part, which is all about self-blame. She started going down the self-blame route. She got very, very engrossed in that traumatic time. So I use the loving eyes, where you try to get them really grounded right in the beginning, and you want them to stay. So while they're going to do, so I use bilateral stimulation, but while they're sitting in the room there, you want them very much to be that rational adult part, and you just want them to look at the child back then, but not get into that, into being that child again, and look at that child. And there's a series of questions, you know, can that child hear us? Can that child,
I know that, yeah.
Yeah.
There's a protocol.
This sort of thing, and they start to empathize.
Yeah. If you saw a little boy or girl and it was 3 or 4 that was feeling unloved, and you were looking on that little boy with loving eyes, how would you feel? So it's about creating an empathic pathway. Sort of in resource therapy terms, what we use is what's called find relief. The same sort of deal, except it becomes a part of the person. Mm-hmm. And so we would say, you know, and this is going to be hard for someone that's never had any nurturing.
Yeah, which is her case. She couldn't.
She got animals?
No.
Does she like animals?
Yes.
What sort of animals does she like?
Dogs.
Okay, and that's when I'll often go, if you saw a little puppy and it was feeling hurt.
So I used that. We were talking about that in the last one I sat in on.
Did you? Yeah.
Yeah, and that was useful, actually. I did.
Yeah. How did it work?
Well, the loving eyes has worked sort of like well so far. It was the first time she said, when she said, like, you know, she's sad, I feel sorry for her, and that was the first time, because when they're more like confronted with each other, it's like, I hate her.
Oh, that's a different part. Yeah, that's a protective part. That sounds like the voice of a parent, to be honest.
Yeah, and it was her mother and stepfather's voice.
Well, that would be the introject, I think, in
That's it,
research.
interject. So we would tell them to shut up.
Yeah.
Sorry, we're not that disrespectful to interjects, but I literally had, you know, interject mum and dad. We bridged. I had a protector part. She says, oh, I don't want to do this anymore. She's faded in disappointment. And I just spoke, this 3-year-old was out. And I said, what's happening? You know, feeling upset, and got a name. And they're moving house. And the 3-year-old, you know, but then when we spoke to dad was just like, oh, I just need to sell the house. I've moved on. I've left your mother 18 months ago. But this little one is still left. What I'm saying there, the interject was super rejecting, just like those parents are, Simon.
Mm.
Yeah. But when you sort of get them to be able to say to that man, and I coach people like that, I'm like, gosh, you know, I'm sorry that you aren't there to see your beautiful little girl. And we do another thing with rejection.
Every little girl deserves to have a loving father or whoever, uncle or
unconditional love.
And that's something, again, in resource therapy that Gordon is so good at. When he intervenes in when he's working with a client, just to remind, and we seem to like know that intellectually, but they don't know that. It's like, oh, you know, it's a very powerful step. That's for sure. Just helping them to connect with that. Yeah.
And what, so we do this like thing, interject, speak as well. If they speak to the, you know, the parental caregiver or whoever it is that's being not less than loving, let's say, and it sort of says, oh, well, she should just know I love her, you know, whatever's happening. When they bring that back and talk to the part again, so a little upset 3 I spoke to again, that part comes back with the emotional sense, the sensory experience memory, call it in Australia, in resource therapy terms, of that, my parents' inability to show me love.
They're incapable. Them, not me.
It's not me.
Paul, yeah. And even though for us therapists, it can be so obvious, it's not for your clients. You know, just take it slow, take it easy. You know, you'll get there. You know, you really will.
Thank you. Any other questions? I'm just loving this. If anyone wants to come forward who hasn't said anything, thank you, Simon. That's really great. And you're doing great work.
Everybody,
absolutely.
Sounds exciting.
Yeah, just a new message, because I'm aware of the time.
Yes.
Thank you. And Susan, anyone, what have you can take away? What's this, just connecting with you all here? Is there, just to unmute yourself and say good day, and what's something that you're sitting with perhaps here as we draw a close to this evening? I'd really like to hear from people we haven't really had so much of a good day. If you'd like to unmute yourself and just let's do a little round of love, and you please unmute yourself and share that. And I love that you put in the chat.
Hi. I'm actually hearing a lot from other methods of therapy using the word part more and more. And they're not resource therapists, but I'm hearing the word referred to a lot more in all sorts of methods and different webinars and seminars I'm listening to. And just in general talking, people are using parts as an expression. It's coming into the general vocabulary.
Yes.
And how great is that? How great is that?
Yeah.
Now that people, it's like destigmatizing something.
Yeah.
And I think that's just a brilliant thing that's across the board in general conversation, whether you're a therapist, whether you're traumatized, just in daily chit chat, to talk about, oh, there's that part of me again.
Exactly.
Nice, huh?
Yeah.
That it's coming out in general conversation.
Yep.
I think that's wonderful.
Thanks, Susan. Do you want to
I
say,
think
yeah, that is wonderful.
It's important to get trained, though, I really believe. And it's not that obvious. It takes some time and practice to really get it down pat. We can talk about it, but actually when you're working with clients and following steps and trying to interweave, you know, who they are with, you know, with parts and with EMDR, with whatever hypnosis, whatever you use. It takes a lot of creative practice and practice and supervision and to get it, yeah, to the benefit of your clients. But I'm so happy too, Susan, that this is something that people, you have to use it. You cannot not use parts therapy. Yeah.
It just seems to be raising awareness that we're not just one.
Definitely. Thank God.
Yeah, and that we're reflecting on different parts.
Yes.
Yeah.
It's reassuring.
Reassuring, nice. And parts language, yeah, thanks Susan, really great. And we do offer like parts therapy training, 2-day introduction, which is good, and online. I'm actually going to be offering the online version that it's pre-recorded, and you'll see live demonstrations and a real overview of resource therapy, the foundations, and then we run the clinical. So shoot me a message if you're interested in that, and I'll be putting that up. I'm in the moment of editing that, so it's pretty cool.
That's great. Yeah, go girl, go.
I love it.
Following on from Lynette's conversation, it's Donna here.
Hi, Donna.
How are you? I was just saying, you know, how she's saying she's hearing more and more the words parts within therapy. I think that, you know, the way to sum it up is like we're one-dimensional, you know, we're not, but we're becoming multi-dimensional these days, you know, and that's why I think it's why more people are identifying their parts within themselves, because we are facets of so many multiple personalities, and people are identifying that now. They're seeing it in themselves every day. We're not, when we used to think of ourselves as just one-dimensional, you know, prior. That's how I see it anyway.
Beautiful.
Yeah.
Thank you. Yeah, it is. We are more multidimensional, and it's good. It is like freeing to have a childlike part to enjoy something, like a bit of chocolate.
Exactly. Playfulness.
Yeah. I'm going to be Netflixing soon on the couch. And I imagine you're going out through your day. And all of us, our therapist parts, I mean, what beautiful learning parts that you showing up here. It's amazing. Yeah. Any other parting thoughts or words? Alison, I'm sorry, I did ask you a question. If you want to unmute.
Hello, I'm so sorry. I had a uni tutorial due at the same time. I've been backwards and forwards. I'm doing a group project. I mean, why would they want the group project on now? But anyway, they did. So I'm so sorry.
No, you're fine.
I will enjoy the recording, and I got bits and pieces. I loved bits and pieces. In fact, yeah, from the beginning I thought I'm going to love this, but yeah, just sort of had to be half here. Yeah.
Fantastic.
Well, I hope you're taking good care of yourself, because you sound like you're real busy and
yeah,
Sunday.
yeah, okay. I'm doing okay. I go through phases of real busyness and then not too bad. So yes, we've just got a group project. Once that's done, it'll be fine. And I've cut right back on a few things. So yeah. It's good. Yeah.
Then you'll make it.
Yeah.
Yeah, we don't want you burning out before you get. I feel bad for referring someone to you already, Alison.
Oh, thank you. No, I appreciate that. I actually used to work in the private hospital system, and I've cut right back there. So I'm only doing private practice now. So that's a big difference for me. It is good. I've got two extra days in my world. So
wow.
Yeah, that's great.
Awesome. Thank you, Alison. Lovely to see you again, and lovely to see some new faces and some beautiful, wonderful, not so new faces to me, and in terms of lovely to see Linda and Lynette and Donna, Esme, and Susan, of course. Yeah, we must catch up for coffee because we're kind of like Esme, do you want to say, and Narelle, thank you too.
How are you?
Good.
You can't see me very well. I had to, sorry I came in late. It was traveling from afar in the rain. And then...
Oh my God, Esme. Yeah, I just connected who you are.
Really?
I can see you.
Even though you can't see, yeah, no. So I'm put out into the hallway because it was in the office, the mic was sort of making that ring sound. Yeah. But lovely to hear all the stuff that's going on.
It's lovely.
I'm going to be honest here. You don't mind me saying, if you've been around for a while, like this one has, it's kind of like parts are all part of the therapeutic process.
Yeah.
Whatever that is, you know what I mean? And so just tweaking a little axis here and there of bringing the parts back together, if you like. So it's lovely to learn about the model, the resource model. Yeah, so thank you.
Thanks, Esme. It's wonderful to see you and have you there. And I think you're right. Everything is kind of...
I'm sitting on the stairs going upwards.
Oh man, that's dedicated. Thank you.
I think that's so true, bringing those pathological parts, in any case, to be healed, you know, to feel better about themselves.
Yeah, it's lovely to hear all the work going on. Thanks, Philippa.
Oh, you're welcome. It's such, well, thank you. It wouldn't happen with all of you here, and especially Deborah. Narelle's had to go off and put the kids to bed. She's got a beautiful... and seeing everyone, because this is amazing. And I'm going to continue just every couple of weeks. Yeah. So, yeah. And it's so nice to have this online space.
Yeah.
Thank you, guys. Do you want to just hang out a couple of minutes, Deb, and I'll catch up with you? Oh, thank you.
Take care. Bye-bye.
Bye-bye.
Donna, love you too. Helen.
Yeah.
Bernadette. Yeah.
Right.